Hello and welcome to the hazardous medication handling video. My name is Robin Herman. I am the clinical nurse specialist for hematology and oncology, and my specialty is chemotherapy, administration, and handling. And because of that, I have been involved in a project that is going to involve the whole entire medical center. So as a result, we made a video so that all the staff, nurses, LVNs, and medical assistants that do any handling and administration of medications in general will need to review. This video is going to be on the internet. It's going to be mandatory to view, and then you will be coming to skills validation to take a test regarding the information in this video. So let me talk about what's called USP 800. It also means the United States Pharmacopoeia. So what's that, you ask? Well, that is a federally mandated pharmacological corporation or company that sets up mandates, guidelines for the rest of the federal government as far as employee safety. In this particular case, the USP 800 or United States Pharmacopoeia has set up a huge mandate regarding handling and administration of hazardous drugs. This mandate involves the practice and quality standards for handling hazardous drugs to promote safety for the worker and safety for the worker that's handling, administering, and also for environmental protection, which will be all of the staff nurses, the LVNs, and the medical assistants, or anybody handling these hazardous drugs. This policy also includes the receiving, the storage, the compound, the dispensing, and the administration and disposal of these hazardous drugs. So pharmacy is also very much directly affected by this USP 800. As a result, we have adopted into the LA County USC safety policy this mandate or this policy and procedure into our safety policy and procedure. And the additions to this safety policy, which used to only include chemotherapy, will now include non-cytotoxic hazardous drugs, which will affect the entire medical center, and as well as anybody handling these drugs. So my goal today is to do a detailed overview so you can get an idea of what to be expected with these new guidelines that have been added to our safety policy. So first I want to do a little overview of what is NIOSH. For those of you that don't know, NIOSH is the National Institute for Occupational Safety and Health. It maintains a list of anti-neoplastics and other hazardous drugs in healthcare. Organizations are mandated to keep a list of hazardous drugs within their medical centers that coincide with the current NIOSH list. And then they also may add other agents on that aren't on NIOSH if they feel the need. The organization must review their list on an annual basis, and they can delete or add any drugs that NIOSH has deleted or added. And then whenever a newer agent appears, and there's new agents all the time that are considered hazardous, then they will have to be added to our safety policy. So, as a result, the LA County USC Medical Center has updated its list of hazardous drugs based on downtown DHS Medical Center policy. The purpose of this training and video is to provide training on handling and administration for all healthcare workers who will be administering these non-hazardous drugs. The following information is going to include guidance for the staff RN, LVN, and medical assistants on personal protective equipment and handling when you are administering these hazardous medications. It will also include transportation, administration, and disposal. I just want to say once again that chemotherapy will still continue to be handled by chemotherapy certified RNs. Chemotherapy certified RNs go through a 16-hour class, a 20-hour web-based program, and spend anywhere from 5 to 10 days with a certified trainer, which is usually me, as far as handling and administration. They will still handle the chemotherapy. How will you know what's chemo and what is not? Well, we'll provide you with a list of all the general medicine hazardous drugs that we feel the general medicine nurse may be handling. And those will be available in your medication room. So let's talk a little bit about what a hazardous drug medication is. This includes all chemotherapy, but also these new drugs that have been added that are general medicine drugs have also been added to the hazardous medication list. And that's because they have one of these characteristics. Carcinogenicity. That is an agent that can cause cancer. We do have several chemo agents that we know directly cause cancer. Radiation can directly cause cancer. There's some cleaning agents like benzene that we know exposure can directly cause cancer. So now there have been hazardous drugs, non-chemotherapy hazardous drugs, that have carcinogenicity and can directly cause cancer. Genotoxicity. Those are drugs, when exposed to, create a mutation that damage genetic information within the cell. And when you damage the genetic information within the cell can mutate and into a malignancy or into a problem or an issue or a medical event. So those drugs that have any genotoxicity, they also have been added to the list. We then have drugs that have reproduction toxicity. And these are chemicals that interfere with normal reproduction. Overlapping with that is tetragenicity. And those drugs that have tetragenicity toxicities or developmental toxicities are agents that can disturb the development of a growing and dividing fetus and also can cause congenital abnormalities. Now, most of the drugs that have been added to the general medicine hazardous drug list either have tetragenicity or organ toxicity, and which means they have reproductive issues. And that's why they've been added to the list, and that's why there have been guidelines set for protection as far as handling and administering for the staff nurse or the LVN or medical assistant that's handling these drugs. Other drugs that also have been added have structure and toxicity profiles that mimic existing hazardous medications according to the above criteria. So once again, this is a summary of what drugs have been added to the hazardous medication policy. Now, when we talk about medication categories, pharmacy has done a really wonderful job of categorizing these drugs into Group 1 and Group 2. Group 1 is purely anti-neoplastics, chemotherapy agents that are used in the management of cancer therapy. They are in a dosage form. We also divided the groups into A and B. So Group 1A is hazardous anti-neoplastic chemotherapy agents that are in a dosage form that require further manipulation. Well, what does that mean? It could mean that you're giving it as an IV infusion. It could mean you're applying it as a cream, a gel, eye drops, other things like that, where you will actually be directly close to the drug and manipulating it to administer it to the patient. Group 1B is also still anti-neoplastic hazardous medications, and they do not require any more manipulation. So these are your oral meds that the patient will just swallow, so they're very easy to administer. Unless, of course, the patient cannot swallow and they have a feeding tube. Then they need to be manipulated to administer them. That means these drugs go back to pharmacy. They will manipulate them under their special biological cabinet, and then they return them to the chemo nurse and she administers them. So that's our chemotherapy agents. And we only allow chemotherapy certified nurses to administer them. And right now we have a procedure in the hospital where 7B is called on a regular basis to go down and give these drugs for these patients that are not actually on the unit. We have that system set up. Now with the addition of the Group 2 A and B drugs, that's put a huge workload on 7B. So for that reason, we are training all the other staff nurses to be able to give these non-chemotherapy hazardous drugs. I also want to mention that USP 800 does not go into effect till July of 2018. So we are not mandated to activate this policy until then, but pharmacy has decided to start doing the training early on. So that's why the video, and that's why the new booth and skills validation. All right, so back to Group 2A. Group 2A is the group that you, as staff nurses, LVNs, and medical assistants in the general medicine areas are going to be very concerned about. Those are the drugs that you will be handling. They are non-neoplastic medications, but they, Group A of the 2 group is in a dosage form that requires further manipulation. And once again, just like the chemo agents, they're intravenous, they're IM, they're sub-Q, they're gels, they're creams, they're eye drops. But once again, manipulation is included in the handling and administration, so you will be affected by that. Group 2B, once again, are oral agents, very easy to administer, that don't require manipulation. Once again, if you have a patient that cannot swallow or has a feeding tube, and that's the only way he can get his medications, those drugs will need to be returned to the pharmacy and manipulated under a special biological cabinet, which I'll talk a little bit about more in a minute, and then returned to you so that you can safely administer them in the G-tube. Now, if it is a liquid and it has been manipulated, that means your gowning and gloving will be different than if you're just handing a pill. And I'll talk about that when we get to PPEs, which are personal protective equipment. All right, so once again, as I mentioned, for this video, we're dealing with the categories of Group 2A and 2B. All other categories are considered chemotherapy, and only RNs that are chemo certified will be handling them. This group of drugs, the RNs that handle this group of drugs have already had detailed training. So 7B, the infusion clinic, there is a group of hazardous drugs that are administered in rheumatology, such as the methotrexate. They too have had special training. So once again, that group of drugs will purely be based by the people given special extra training for chemotherapy agents. And that's Group 1A and B. Group 2A and B is what we're talking about for this video that will affect the general medicine areas in the LA County USC Medical Center. So first let's talk about dispensing. So hazardous medications must be dispensed by the pharmacy staff as a final product that minimizes or eliminates requirement for further manipulation by the staff. Once again, our entire goal is the least exposure of these drugs to our staff. So splitting, crushing, any opening of the dosage forms that have to be manipulated in any way, and once again that includes your patients that cannot take oral drugs that have to manipulate it to get it into a feeding tube. That is called compounding, and 100% of compounding is done in the pharmacy. And the reason for that is it is mandated that any compounding of any hazardous drug take place in a biological cabinet that is mandated by the NIOSH policies and procedures and approved by the NIOSH policies and procedures. And we do have these biological cabinets in the pharmacy. I do want to add a little sidebar that because of this new policy, pharmacy also is going to need some extra space and some extra cabinet space, especially since our chemotherapy patients have skyrocketed just in the last year. And the only reason I bring that up, it's not the issue for the nursing staff, but where they find a new place, where they end up compounding these additional drugs may delay how quickly you get the drugs. And so I just want to say that you need to be patient whenever you're waiting for your hazardous drugs, or should I say that you're going to also be picking up your hazardous drugs, which we'll talk about in a minute. If the patient cannot take a pill, as I said before, contact pharmacy and they will decide on the safest way to manipulate the drug so you can safely administer it to the patient. So once again, groups 2A and B are non-anti-neoplastic, non-chemo, hazardous medications, but they still will also bear a yellow label with the words hazardous, dispose of properly on the label. Now that doesn't necessarily mean they're chemo, but they still will bear the same label. And you will know what's chemo and what's not depending on the list that will be in your medication room. So if it is designated as chemotherapy, you should be calling 7B if you're an inpatient area in the medical center, or actually if there's any ambulatory chemotherapy, the patients will be going to the infusion clinic. All right, so as far as transport, Non-anti-neoplastic medications must be transported in a sealed plastic bag. So that brings me to the next thing, that the unit will have to pick up their hazardous drugs directly from the pharmacy. This will be the first part of an extra workload that's going to affect the entire medical center. If right now all chemotherapy is picked up by the unit, so the infusion clinic actually walks across from building B to the inpatient unit probably every 15 to 30 minutes for 10 hours a day, picking up chemotherapy and transporting it back. 7B, the oncology, hematology ward that gives chemotherapy, walks and picks up all of their own hazardous meds, their chemotherapy. As a result, the entire medical center will have to send someone to an area, which we will show to you once we go live, and pick up your own hazardous drugs. These drugs cannot be tubed in the tube. It is too dangerous. If they break or there's any exposure to the tube, the whole system would have to be shut down. So that's why the pickup from the pharmacy area. A chemotherapy spill kit must accompany hazardous medications during transport. This is not required for medications that will not spill. So all of your oral agents, you do not need a spill kit. And I'll show you the spill kit later, and we will review how to handle the spill kit. On your unit, there must be a designated area for all hazardous drugs to be held. As of right now, 7B is using a space in their medication room. The medication rooms, as a result, are very small, and this is going to be an extra issue for the entire medical center, but you just need to find a safest place, and the medication room is going to be the mandated area that these medications will be held. So we have a cart with a yellow bin, and I will show you the yellow bins later. As they come up, they're sat in the yellow bin separate from any other medications, and then from the yellow bin they're delivered directly to the patient and administered. Body fluids and hazardous medication. This is going to be another workload that is going to be a little bit complicated for all of the general medicine areas. Following administration of any hazardous medication, whether it's chemotherapy group 1A and B or hazardous medication 2A and B, all patient body fluids must be treated as hazardous for 48 hours. Well, what does that mean? That means stool, urine, emesis. All of that is considered hazardous for up to 48 hours after the completion of the hazardous drug. So if you have a patient on an oral medication that's hazardous, that means their bodily fluids must be handled every single day if the pill is taken every single day as hazardous. So that means that the healthcare provider, whether it's the RN, the LVN, nursing attendant, medical assistant, should gown and wear chemo gloves when handling any bodily fluids for up to 48 hours after completion of the hazardous medication. The other issue, if bathrooms are shared, the toilet seat must be wiped down with a bleach product in between and after it is utilized by every patient who's receiving chemotherapy so that the next patient using it is not exposed. And it should be wiped down with a bleach product, a cabby wipe of some sort. And as far as what we're allowed to have on the units and what the patients are allowed to have, we will work that out and in-service you at a later date. All right, Group 2A, non-hazardous medications requiring dosage manipulation. Now, they may be administered by any medical center personnel that is authorized by the medical center to administer medications. And they require what's called full PPE, full personal protective equipment. So what does that mean? Well, that means full PPE is gowning and gloving, and I want to go over the logistics of what gowning and gloving is. And then we will show you a demo of gowning and gloving. So first let's review it, and then we'll go to the demo. So chemotherapy gloves should be latex or the nitro gloves that we have on all the units. They're purple at this point in time. All drugs handling any hazardous medication should be changed every 30 minutes or whenever torn, punctured, or visibly contaminated. all chemotherapy, all gloves handling hazardous drugs, you must be double gloved. And I'm going to show you how to place the gloves on. In addition to the double gloving, you're required to have a chemotherapy gown. The standard yellow isolation gown meets the required guidelines from NIOSH for chemotherapy, semi-water resistant. Now the biggest question I always get is, pharmacy wears a thick blue gown. Why do we only get the yellow gowns? Well, the yellow gowns meet the required criteria. The blue gowns are extremely thicker, have a lining, and that's because pharmacy has much more detailed, extensive exposure than the staff nurse at the bedside, and they're quite a bit more expensive. So that is why we are going to stay with the yellow isolation gown. Now, once again, you should change your gown every 3 hours or whenever the gown is torn, punctured, or visibly contaminated. Personal protective equipment should be worn in the area you're handling and administering the drug only. You should never wear it to other areas. So for group 2A medications, you also will be adding what's called a Spiros adapter. And this is a new addition for the entire medical center, including chemotherapy hazardous drugs and general medicine hazardous drugs. And I will show you how to work with the Spiros in a visual also. The Spiros will come attached to your hazardous drug that is going to be infused, and the tubing will be primed with saline. So pharmacy will send up all your hazardous drugs with tubing attached and primed with saline, and the Spiros will be attached to the tubing so you may lure lock it into your regular IV tubing. They have also mandated that we have a Spiros attached to the end of our IV tubing that is then attached to our extension set. And so I will also demonstrate that to you too. So you'll have 2 inline Spiros to protect you from any exposure. If the Spiros becomes disconnected at any time, it will immediately shut off, so you will have no leakage. And once again, we'll do a demo for you in regards to the Spiros application. All right, so now let's talk a little bit about group 2A. This is a huge, lengthy list. I do not know a lot of the drugs on here. I sort of reviewed a few of them, but it got so lengthy. There are a few I do know, like Zometa, which is the one down at the bottom here. You guys know it as Reclass also, or zoledronate, Zometa. This is a drug that's used in a variety of issues. It's used for lytic lesions in the cancer patient. It's also used on a regular basis for osteoporosis. And it's been coming up with a yellow label for over a year now. So the staff nurses are calling 7B, and it's been a huge workload for them to come down and administer this drug. So staff nurses can just gown and glove, as I mentioned, with a double gloving and gowning, and administer it directly, effective immediately. Other drugs on here, like cyclosporin, you may recognize. Iridia is another drug for osteoporosis or hypercalcemia. So once again, this is just the first part of the non-chemotherapy general medicine drugs that are now considered hazardous for some reason, and the reasons I mentioned earlier, the cardiogenicity, the tetragenicity, each and every drug has its own little personality of why it's now mandated to be on this hazardous drug list. So this is the IV, IM, sub-Q formulations. The next group is other dosage forms, and these are topical creams or gels. They may be oral solutions, vaginal creams, inhalation drugs, topical ointments, eye drops. So these are other dosage forms in group 2A that may require manipulation by the person handling and administering. So these 2 drugs are also on the list for hazardous drugs in the general medicine area. All right, so now we're going to move on to group 2B. These are non-chemotherapy agents, non-antineoplastic, but still hazardous medications, but they should require no dosage manipulation. And it applies to tablets and capsules only. And they may be administered by any personnel that's authorized to administer medications at the medical center. Once again, if you need to manipulate these oral drugs so that the patient may be able to absorb the drug in a different way than orally, it should go back to pharmacy, and pharmacy will then manipulate it for you under the hood. Group 2B only requires single gloving with chemo drugs, with the chemo, or what we call the nitrile glove, so the purple glove. You don't need a gown, you don't need a double glove. Group 2B is only the single pair of nitrile gloves. Once again, though, they do need to be changed every 30 minutes whenever torn, punctured, or visibly contaminated. So they still meet the same guidelines as Group 2A, but only a single pair of gloves, no gown. This is the list of drugs on Group 2B, and once again, this list has a lot of drugs that I don't know what they are. Some of them I do, but it is a pretty lengthy list, and once again, this group of oral agents meets the criteria I mentioned earlier that now make them hazardous. But because they are in the general medicine areas, all of the RNs will need, and LVNs and medical assistants that are authorized to administer medications will be required to go through this training and then use safety guidelines or PPEs when administering. This is just another page of this drug, of these drugs. You can see there's some hormonal drugs on here. They have been designated as causing tetragenicity and reproductive issues. Granciclovir is a drug that interferes with division of the cell of a virus. And so that's why it's on the hazardous drug list, because it can interfere with, that gives it what is called genotoxicity. So just an example. Once again, another list. It's a very lengthy oral list. Spironolactone, that's another drug that you guys give commonly. So once again, on the Group 2B oral list, lengthy list you guys will all have to individually review. This list will also be available in your medication rooms. Again, another part of this oral list, tacrolimus is another drug. Uracil mustard is actually a chemotherapy agent, and we do not know why that the NIOSH put this on the Group 2B drugs. And actually, we're not really even using it in the medical center, but that particular drug will be administered by a chemotherapy nurse, but we left it on the list as NIOSH presented it. We did not put it back on the chemo list. So that was pharmacy's decision. All right. All right, so now we've administered the drug, we picked up the drug, we've dispensed the drug, we transported it, we've administered it, we move on to the next step, which is disposal. And disposal of hazardous drugs is a very special procedure. It's very different than any of our other non-hazardous drugs. It does not go in the blue bin, it does not go in the red bin, it does not go in the general trash can. All empty hazardous drugs, bags, vials, whatever it may be, must be disposed of in a yellow Sharps container. And I call it Sharps because it's a big plastic bin that looks very much like your red Sharps container, but it is yellow, and yellow is the universal color for hazardous drugs. Any bulk hazardous medication, anything, let's say you start to administer an IV bag and you don't finish it, or you have eye drops that are not finished, they must be returned to pharmacy. They have a completely different disposal system. A different company picks them up, a different company disposes of them. It's much more costly, but they must be rebagged and transported back to pharmacy, to a special bin in the pharmacy where we return our hazardous drugs that are left over. All items that are utilized to administer the hazardous drugs are to be disposed of in the yellow Sharps container. This includes your gown and gloves, any of your tubing or your IV bags that were attached to any infusions, or any paper items that may be attached to the hazardous drugs. And then I also want to say, when you're removing your PPEs, I'll also show you in the video, your top pair of gloves come off first, then your gown, and then your bottom pair of gloves. And we will also demonstrate that in a little bit. Now, there is one exception to the yellow Sharps container, and this is another little item thrown onto the USP 800, And this is a group of drugs that are under what we call the Resource Conservation and Recovery Act. So these drugs are also considered toxic and they cannot go to landfill. And any of the drugs on this list must go into a black sharps container. Now, most of these drugs, as you will see on this list, are chemotherapy. So it will not affect the entire medical center, but you also have several drugs that you use very commonly. Nicotine, nitroglycerin, warfarin, they are all on this list, which means that you will need to dispose of these drugs if they're left over or they're not used or they have packaging in a black container, and that will need to be picked up from pharmacy. Now, the other thing that's interesting is that these drugs are not hazardous when you handle them. You can handle them with ungloved hands, no gown. But as far as disposal in the ground, they do need to go in the black container. And that's because of this Resource Conservation and Resource Act, which is also part of the NIOSH guidelines and USP 800. All right. So now we're going to go on to spills of hazardous drugs. A chemotherapy spill kit must be located in all areas where routine handling of hazardous medications occur. And it's my understanding most of the units have spill kits on them now. If you do not, we will let your nurse manager know how to order one. Upon identification of a hazardous spill, I am now going to go through the policy and procedures of how to address a spill and clean it up. So personnel who are qualified to manage a spill should be informed to assist with the spill cleanup. And that will be all chemotherapy certified nurses, but now also all general medicine nurses, LVNs, and medical assistants that are going through this training and through this video. Now, the following items must be worn during spill management, and that includes a chemotherapy gown, a double pair of chemotherapy gloves, an N95 respirator. Now, that is the orange mask. It's found in the spill kit, and you also have it on your units. But if you do have facial hair, you will need a special device to help clean up the spill. The N95 respirator will not meet the safety guidelines for you if you have facial hair. So please ask your nurse manager what is the device that you would need to clean a spill. Also in the spill kit is a pair of safety glasses and booties. As far as the procedure, we're going to talk about spills in regards to size. Our first size of spill is anywhere from 5 to 100 milliliters, or 5 to 100 grams of powder. Now, as the person administering the medication directly to the patient, you should not be involved with anything that is in powder form. All of our hazardous drugs will be compounded and put in a gel, a liquid, a pill, or a IV, IM, or sub-Q formulation. So powder will pretty much pertain to the chemopharmacy that mixes the hazardous drugs. So as far as your role in cleaning up the spill, the first thing you want to do is remove all patients, visitors, and any non-vital personnel from the affected area and restrict further access. In the spill kit is a sign that does say keep away from the area. And you must restrict access with at least a 5-foot space around the spill. As you move on to clean up the spill, the first thing you're going to do is don your protective wear. And the order of donning the protective wear should first include your booties, then your top pair of gloves, then the gown, or the bottom pair of gloves, then your gown, then your top pair of gloves, which go over the cuff of your gown. Then you'll supply your facial wear, which will be your goggles, and a hairnet if needed. The hairnet is optional depending on the situation. The next thing you will then do is take the paper pads that are provided in the spill kit. You will lay them on the liquid and let it absorb the liquid. Once the liquid area is absorbed, you will then gather that paper products and place them in a yellow trash bag, also found in the spill kit. And then you will grab your bleach wipies that you have on your units, and you will clean the area with that bleach product. Once that area has dried, it is then okay for activity, and you can open up the area for whatever you need to use it for walking through or usage in patient care. Then you will remove all of your protective equipment. The first thing that comes off is your booties, then your top pair of gloves, then your gown, then your bottom pair of gloves, and then your facial wear, your goggles and your hairnet. All of that goes into the yellow trash bag. That yellow trash bag is sealed, and that yellow trash bag goes into a yellow sharps container. And then it is picked up by a special transport team that picks up all hazardous drugs. The other thing that you will be required to do is a safety intelligence report, which used to be called a PSN. And then there is a spill report form inside the spill kit. That should be filled out completely and given to the nurse manager, and she will be required to submit it to the medical center safety office, as well as follow up on the safety intelligence report. Now, spills greater than 100 milliliters or 100 grams of powder, and once again the powder will only apply to pharmacy, will require only qualified personnel to clean up. Now, the entire procedure is the same as it is for the smaller spill. Getting the spill kit, donning the protective wear, using the protective pads to clean up, using your bleach product to clean up the area, and everything in the yellow yellow bag is exactly the same. Sorry. The extra piece is contacting the medical center safety team at 111 and discussing with them the decision on who will clean up the spill. So facilities management in combination with the safety office will make that decision. And I do have to tell you right now, as far as chemotherapy spills, the chemotherapy certified nurses are cleaning up 100% of their spills regardless of size. And that's because of their training. And the safety office may not be available on the off shifts. They may not be able to get up there in a timely manner. So just so you know, it may end up being on the staff nurse at the bedside, or whoever was dispensing the med, or whoever part of the nursing team that was trained to clean up the small as well as the large spill. Alrighty, so now we're going to move on to exposure to hazardous drugs. Any personnel who is exposed to any formulation of the hazardous medication, whether it's dermal, mucosa contact, maybe it's you were giving an IV drug and you were injected with a needle, ingested by some chance, inhalation, or any other means, you must take steps to minimize the severity and duration of the exposure immediately. So the first thing you want to do is wash the affected area. If it is skin, go to the nearest sink and wash with a gentle soap thoroughly to remove any of the exposure of the drug. If you have an eye exposure, you need to go to the nearest eye wash, which sometimes is in a locked custodial cabinet. And if you can't get to it, go to the nearest sink and then rinse out your eye anywhere from 6 to 10 minutes. If you don't have access to either one, take a pre-filled saline syringe and actually rinse your eye out with that, once again, from 6 to 10 minutes. And then once you've done cleaning off the spill exposure, you need to report immediately to your supervisor for evaluation, and then they will send you to the employee's health center. If it's after hours, you will go to the ER, and then follow up with a healthcare provider will be administered to evaluate your exposure. All unintentional exposures to hazardous medication must be reported to the medical center safety office as soon as possible. A safety intelligence report, previously known as a PSN, must be done immediately. And then once again, employees' health will need to be notified about your exposure. Now, if you are trying to get pregnant, if you are pregnant, if you are breastfeeding, and for men, if you are trying to conceive, then you must collaborate with your nursing supervisor to minimize your handling of any hazardous medications. That means you should not be doing any direct handling or administering of these medications. You may still care for the patient, but direct administration should not be done by anyone trying to conceive, pregnant, or breastfeeding. Now, as far as your medical surveillance, right now, chemotherapy nurses have a very intense medical surveillance. And when they go to employees' health, we have a lot of blood drawn and a lot more advanced surveillance. But these are drugs where the nurse is exposed every single day and much more directly. As far as medical surveillance for personal handling hazardous medications that are general medicine medications, they're still developing that policy, and actually downtown DHS is developing the policy on what each employee's health is going to do. So if you're a general medicine nurse going for your annual employee health evaluation, you will let them know that you occasionally handle hazardous drugs, and they will decide on the detailed employee health evaluation that you will have. And once again, this policy is still being built. So we'll eventually find out how it will deal with these non-chemotherapy hazardous drugs. Now, once again, inform employee health and your nurse manager if you have been exposed to any hazardous drugs, whether they're anti-neoplastic chemo drugs or they're general medicine hazardous drugs. And then also, once again, during your annual evaluation, that you are handling hazardous drugs, whether it's detailed chemotherapy daily or occasional general medicine hazardous drugs. Now, last but not least, there's a variety of equipment you will need in your areas. All areas will need a spill kit. So if you don't have one now, you need to make sure you have one on your unit, maybe even two, so that you can use one to transport back and forth to pharmacy as you pick up your medications. All units will need a yellow sharps container. Now, what we have in stock right now are the 8 gallons. There is a smaller sharps container. I will be showing you the 8-gallon later, but you can order the small ones. And as far as the general medicine wards, that is all you need, and I think they're 3-gallon. You will need a yellow bin in your unit, usually in your medicine room, where all of the hazardous drugs will be delivered to or kept until they are administered to the patient. A black disposable bin will be necessary if you have any of the drugs on the black disposable bin list. Those are rare, mostly on the chemo ward, so most of the units will not need those, but just in case they do, you will need to occasionally pick up a black disposal bin. And then last but not least, you'll need the Spiros adapter added to your PARs for your equipment, because that Spiros adapter will be added onto the end of your general IV tubing for all your plain IV hydration. And once again, we'll be doing a demo of all these products as part of this video. So with that said, once again, this is a federally mandated policy and procedure, USP 800. We really don't have much of a choice on what we decide to call hazardous or non-hazardous. It is now part of our safety policy, and as you review this video and go through skills validation, you will then be considered certified to handle the non-chemotherapy hazardous drugs on the general medicine unit. So thank you very much for your participation today and review of the video.